Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on sleep problems. Good sleep is a crucial aspect of health, but sleep problems are some of the most common reasons to see a doctor. So this is a really important topic that you need to know about. We're going to be covering types of sleep problems, complications of poor sleep, sleep hygiene, and medicines to treat sleep problems. Now, if you like content like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future episodes. In addition, if you have any questions, leave them in the comments down below and I will answer all of them. Now, before we get started with sleep problems, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having any symptoms or if you're having problems with sleep, make sure that you see your doctor right away. Now, let's get started with sleep problems. In order to understand sleep problems, let's first address what does healthy sleep look like. The number of hours of sleep per night varies from person to person. Some people don't need that much sleep and they do well with 5 or 6 hours a night. Some people need a lot of sleep, as many as 10 hours of sleep per night. But I'd say that the majority of people do well with 7 or 8 hours of sleep per night. You want to be able to fall asleep right away without having to spend too much time trying to fall asleep. And you want to be able to sleep through the night uninterrupted, never waking up for any reason. So even though healthy sleep varies a lot, I'd say that for most people, we're talking about 7 to 8 hours, falling asleep right away, and not waking up during the night. Some people have trouble sleeping because of an underlying medical problem. There are a wide variety of medical problems which can interfere with sleep, but we're going to talk about some of those today. And those problems include chronic pain, anxiety, having a large prostate, and obstructive sleep apnea. Chronic pain is both common and serious. Some people suffer from chronic back pain, or chronic leg pain, or chronic shoulder pain. Chronic pain interferes with our daily lives because it makes it difficult for us to perform the tasks that we wish to perform, interfering with our quality of life. Unfortunately, chronic pain can also hurt our sleep. It's difficult to fall asleep when you're experiencing pain. And what's more is that while we sleep, we often toss and turn, and this can exacerbate our chronic pain, waking us up and interfering with our sleep. So, unfortunately, chronic pain is a common cause of poor sleep. Anxiety disorders, unfortunately, are common. We all get stressed sometimes, but if you're feeling stressed a lot and it's severe and it's having a negative impact on your life, you may be suffering from an anxiety disorder. Unfortunately, anxiety interferes with our sleep. When we're lying down trying to relax, that's often the time of day when thoughts are racing through our minds and our stress peaks, and it can be difficult to relax and fall asleep. So, unfortunately, anxiety is a common cause of poor sleep. A large prostate can also affect healthy sleep. Now, this problem only applies to men. A large prostate, also known as benign prostatic hyperplasia, or BPH for short, is a common problem experienced by men as they get older. A large prostate can cause urinary symptoms, the most common of which is peeing more often than usual. And this becomes a big problem in the evening. A lot of older men who have a large prostate, they find themselves getting up multiple times every night to go and pee, interfering with their healthy sleep. So unfortunately, having a large prostate is a common cause of poor sleep. Obstructive sleep apnea is a serious problem that can affect your sleep. Some people snore while they're sleeping. This can be annoying for our partners, but it's not a problem on its own. But obstructive sleep apnea is different. In this case, it's more than just snoring. Patients are having trouble breathing. They're gasping for breath. They're struggling to get the air in and out while they're sleeping. They might be tossing and turning because they're trying to figure out a position where they can breathe more easily. And all of this is happening while they're sleeping. So the patient doesn't even realize that this is happening. If you or your partner suspect that you're suffering from obstructive sleep apnea, it's important that you talk to your doctor about getting a sleep study. That way we can determine if this is happening. In the majority of cases in which someone is having trouble sleeping, there is no clear underlying cause for their sleep problem. The person wants to sleep well, but they find that they're having difficulty falling asleep, or they're waking up multiple times during the evening, or they're waking up and they're unable to fall back asleep, or they're having some combination of those issues and there's no clear cause why. Sleep problems can cause a lot of damage to somebody's health. When you're not sleeping well, it can cause you to feel tired during the day. It can cause depression. It can cause anxiety. It can interfere with your concentration. It can cause headaches. It could cause you to have high blood pressure. And it can also cause palpitations or even lead to cardiac arrhythmias. So it is crucial that we all work hard to have good sleep so we can avoid these health problems. If you're suffering from sleep problems, one of the most important things I want you to do to maximize the quality of your sleep is to practice good sleep hygiene. Now, what does that look like? First of all, I want you to have a consistent sleep schedule. I want you to go to bed at the same time every night, and I want you to wake up at the same time every day. Set your alarm so that you'll wake up at the same time every day. Do not sleep during the day, and make sure that you adhere to this sleep schedule. The next thing I want you to do is to have a consistent location where you're sleeping, probably your bed in your bedroom. So don't fall asleep on the couch. Don't fall asleep anywhere else except for your bed in your bedroom. In addition, that sleeping spot, probably your bed in your bedroom, only use that spot for sleep. So don't read in bed, don't write in bed, don't look at your phone in bed, don't work in bed, don't do anything in bed other than sleep or sex, and that's it. Now, for all of my patients, I want them all to stay hydrated, eat healthy, and exercise. But I don't want you doing those things right before bed because they can interfere with sleep. Staying hydrated is important, but if you drink a lot of fluids right before bed, it's going to fill up your bladder, and you may find yourself getting up a lot at night to pee. If you eat right before bed, that could expose you to acid reflux or bloating, and that can interfere with sleep. Exercise is important, and when you exercise, your heart rate and your blood pressure go up while you're exercising. But I don't want you exercising right before bed because that increase in your blood pressure and your heart rate can make it hard to settle down and fall asleep. So a good rule of thumb is when it comes to fluids, eating, and exercise, do all those things, but don't do them within 2 hours of when you're going to fall asleep. This will maximize sleep hygiene. While you're sleeping, I want to make sure that you're cool and comfortable. So if you're too hot or too cold, that will interfere with sleep. And something else that's really important about sleep hygiene, I do not want you to have access to clocks while you're sleeping. What do I mean by that? When it's time to go to bed, I want you to set your alarm and put that clock away. So while you're sleeping, I don't want you to have a watch. I don't want you to have your phone. I don't want you to have any clocks that are on the wall because you don't care. If it's nighttime and you're sleeping and you open your eyes, don't look at any clock. Maybe you're feeling thirsty, so you decide to get a drink of water, or maybe you need to use the restroom, but don't look at what time it is because you don't care. Maybe you've been sleeping for 20 minutes. Maybe you've been sleeping for 5 hours. Don't look at any clock and just go right back to bed. If you practice all of those good habits, you'll be maximizing your sleep hygiene and I'm certain that you're going to see improvements in your sleep. There are a variety of different medicines which can be helpful for sleep, and we're going to talk about some of those here. The medicines that I'd like to discuss are melatonin, antihistamines, trazodone, and sedative medicines. Melatonin is a supplement that is safe and effective to help with sleep. Melatonin is actually a natural hormone that is made by your brain, and this plays a role in your sleep cycle. The way that you take melatonin is that you take it every evening, about 30 minutes before you plan on sleeping, and you want to do that every single night at the same time. This will help to promote a healthy sleep cycle. Melatonin is not the kind of medicine that you take it and then you're going to feel tired 30 minutes later, but rather it builds up in your system. So after taking the melatonin for days and weeks, you're going to see improvements in your sleep. The next medicine I'd like to discuss are antihistamines, and this includes medicines like diphenhydramine, which is Benadryl. Antihistamines are used to treat a variety of problems, such as itching or nasal congestion or allergies, and they're also used to improve sleep. When you take an antihistamine like Benadryl, it's going to make you feel tired within 30 to 60 minutes or so you'll have a better night's sleep. Most people who take antihistamines don't have any side effects, but for the people who do, it can make you feel tired during the day or make you feel confused. And this is especially important if you're older. So if you're an older adult and you find yourself feeling more tired or confused than usual, it might be because of the antihistamine, and you should talk to your doctor about this right away. The next medicine that I'd like to discuss is Trazodone. Trazodone is an antidepressant that has been shown to be extremely effective to help with poor sleep. You take it every evening, regardless of how you're feeling, and this is going to gradually improve your sleep. After a week, you'll notice a difference, and you'll notice the maximum effect after 4 to 6 weeks. Most people who take Trazodone don't have any side effects, but for the people who do, you might find yourself feeling tired during the day. And an important rare side effect is if you're a guy and you take Trazodone and you have an erection that lasts at least 4 hours, go to the hospital right away because that's an emergency. Now, I'd like to discuss the sedative medicines, and these include medicines like Ambien or Ativan or Xanax. These are strong medicines that will knock you out. They'll typically cause you to fall asleep within 30 to 60 minutes. They're very effective, but they're also very dangerous. These medicines can make you feel tired. They can cause lightheadedness or blurry vision. They increase your risk of having an accident or a fall. So it's really important that you're safe when you take these medicines. No driving when you take them, no alcohol or marijuana when you take them. The other thing about these medicines is that they're addictive and habit forming. So these are not a good choice to take all the time. What typically happens if you're taking a medicine like this every night is that your body gets used to it and you can develop a tolerance to it. So the medicine will not work as effectively as it used to. And if you don't take the medicine, you're going to sleep very poorly because your body has become accustomed to the medicine. Your sleep gets much worse if you don't take the medicine. Some people have been taking medicines like that for years, and it can be very, very difficult to stop. So the best strategy is to avoid these medicines like Ambien or Ativan or Xanax and only use them as a last resort. And if you are going to use them, don't take them every night. Just take them on your worst nights. Let's address some treatments for some of the underlying medical problems that could affect your sleep. And let's start with chronic pain. Chronic pain sucks, and if you're experiencing this, make sure that you talk to your doctor to come up with a treatment plan to help to get your chronic pain under control. A few medicines that you might want to consider using include medicines like muscle relaxants, such as cyclobenzaprine, or nerve pain medicines like gabapentin. These types of medicines have the benefit that they can decrease your pain and also make it easier to sleep because these medicines can make you tired. So if you're suffering from chronic pain, talk to your doctor and see if one of these medicines might be the right answer for you. For those of you who are suffering from anxiety and this is affecting your sleep, poor sleep is one of the classic symptoms of anxiety. So all of the treatments for anxiety have potential to help you with your sleep. And this includes medicines like the SSRIs, like fluoxetine, or SNRIs, like duloxetine, or the antihistamines like Benadryl. These all have the potential to improve your anxiety and, as a result, to improve the quality of your sleep as well. In the case of patients who have a large prostate, it is especially important to avoid drinking fluids in the evening, since that will fill up your bladder and you'll be waking up multiple times a night to go pee. So have a rule of no fluids within 2 hours of when you're going to go to sleep. There are a variety of medicines that can be effective for having a large prostate, including alpha blockers like Trazodone. So if you have a large prostate and this is interfering with your sleep, talk to your doctor to see if medicine would be appropriate to help you with this problem, medicines like Trazodone. For those people who are suffering from obstructive sleep apnea and this is interfering with their sleep, the classic treatment is CPAP, which is continuous positive airway pressure. This is a mask that you wear while you're sleeping, and this blows air into your airways, and this opens up your airways, making it easier for you to breathe while you're sleeping. There are other devices which can be used, and there are also medicines that can be used, but the gold standard of treatment is the CPAP machine. So if you're suffering from obstructive sleep apnea, make sure that you talk to your doctor to begin treatment right away, and this will improve the quality of your sleep. That's it for today. Thank you for watching. Be sure to subscribe and leave a comment down below about health topics you'd like covered in future videos, and if you have any questions. Remember, these videos are for education purposes only, so if you're having any symptoms or if you're not sleeping well, make sure you go talk to your doctor right away. Bye-bye.